Hello, everyone. Greetings for the day. I'm Sayukta from Hair All Issues Resolved team. I'm sure all of you must be keeping good health. We all know taking good care of our skin is important for more than just our appearance. As the largest organ, our skin becomes the most essential to our overall health. One of the skin problem of so many is acne. Acne is a skin condition that occurs when your hair follicles become plugged with oil and dead skin cells. It causes whiteheads, blackheads, pimples. Acne is most common among teenagers, though it do affects people of all ages. So to understand deeply about acne, let's connect today with our skin expert, Dr. Rachita live from Mumbai to enlighten us on skincare treatment and the case of acne. Dr. Rachita Dhurat, senior dermatologist and trichologist, are very vibrant and highly skilled in this field. Dr. Rachita Dhurat is a board certified dermatologist and a global trichiatrist with 35 years of experience. She is currently a professor and head of department of dermatology at LTM Medical College and Hospital. Post her duty hours, she also helps patients with their problems from her private clinic as well. Her experience has been unparalleled. With a plethora of research work and publications under her name, she is renowned not only domestically but also globally, especially for her groundbreaking work in the field of trichology. She founded a premium conference named Trichology Update in 2014. The conference attracts some of the well known professionals across the globe with the aim to educate young doctors and put these learnings into their regular practice. It's such a pleasure to have you with us, Dr. Rachita Dhurat. Welcome, ma'am.
Thank you, Sayukta, for a lovely introduction. And good afternoon, my viewers.
And today, doctor, we are going to talk about acne, one of the most common skin problems. And we all, even if it's say that it affects teenagers most, but then we all sooner or later do get it. What are acne, doctor?
As you said rightly, that it is very common. That does not mean that you should not treat it. People think that it is so common in teenager, adolescents, why to treat? But there is so much concerns or health issues are involved in related to acne, and we are going to understand it. So acne is commonly known as pimples. So everyone knows. And then why do we get it? Majority of people do get acne some point of that. And sometimes it subsides on its own, but rarely. But however, you require a treatment. The mechanism is totally different for formation of acne. It's a long process. Okay. So if you have to explain, it may take 1 minute. Do I explain to you?
Yes, please do.
You need to understand oil glands. Everyone has oil glands in the skin, especially these oil glands, which we called as sebaceous glands, are present on more on face, back, shoulders, and upper arms. So what happens? What is the function of these glands? These glands secrete sebum and hydrate our skin. And these glands also connect to our hair follicle. And in what happens in healthy skin, these glands make sebum that empties out on the skin surface, and thereby our skin does not dry off. We get lubricated skin. When these glands secrete oil substance, that is sebum, also carries out our dead skin cells. Like frequently, every few weeks, we secrete some, shed out some dead cells. So these dead cells, along with the sebum, empty out on the skin surface through the pore. Pore means the opening in the hair follicle. But whenever there is an excess amount of sebum and excess amount of this shed dead skin cells, what would happen? Everything will not come out. So it gets accumulated under the skin surface. And that accumulation is known as your acne. Now, this are depending upon this type of the accumulation. If sometimes bacteria uh, gets attract to this sebum, and they it cause inflammations. So you have the stages of acne. Either it could be small bump or red bumps or cysts, depending upon the stages of acne. So in this is in short the how the acne is formed.
Right. So this is how acne is formed, and this is what acne is. Now, another thing is, doctor, that who gets acne? Who are those who are very prone to acne?
Prone means those, there are many reasons for this.
Mhm.
Why do we get acne in teenagers? It's mainly because hormones. Now, which hormone is responsible? Everyone has some hormone, that is testosterone.
Hmm.
Now, this sebaceous glands are sensitive to these testosterone, and thereby there is a more secretion of sebum by sebaceous glands. And that's why we see acne more commonly in teenagers. But however, we also see acne after 25 years of age, that we called as acne tarda or late onset acne. And the reason for that could be mainly is a subtle or major hormonal changes. Okay. Apart from these this factor, other contributing factors could be your diet, wrong cosmetics, wrong cosmetics, or you are using cosmetics for and not removing your cosmetics,
Mhm.
and sometimes genetics also. Like if your parent, one of the parent had acne in adolescence age, you're probably more likely to get acne. If they have more severe acne, probably you may get more acne.
Right. Does doctor, we can say that family history also matters in case of acne?
Yes, that is genetics. Family history matters here.
Right. And what should we do? I mean, what's that we need to do in case we are getting acne?
What you have to do, there's so many things to be done. Mainly is that people think that when you get acne, you apply a home remedy. They don't seek advice from a dermatologist, and they keep on doing only home remedies. I feel that I'm not totally against all home remedies, but then there's some caution about home remedies. Like for example, you heard of application of toothpaste
Those,
or
yes.
garlic? Yes or no?
Yes.
So what happens, you think that yes, it helped your friend or someone, that's why you also apply, but then we have seen very bad reaction to garlic and toothpaste in such a way that your acne can become burnt out. It can cause a severe scar.
Mhm.
So when you use such type of the home remedies, you should be very cautious. Other home remedies, I can talk about your honey. Okay.
Mm.
In fact, we had done study on use of honey, and it helps in certain patient. It helped in certain patient who had acne of inflammation, the red bumps. Now, there are many types of the acne,
Right.
out of which there are red bumps acne, which we called as inflammatory acne. It certainly helps, but then don't use a raw honey because raw honey is not sterilized. Correct?
Right.
And sometimes aloe vera, but then people use aloe vera plant directly like that. It is a very crude method of using it.
Mm.
So you don't use the direct aloe vera. So these are the caution when you use any home remedies. If you're finding it is burning it out, then it is a cautious not to use this kind of the home remedies, and not for a long period of time. Don't keep on using for a long period of time in a hope that sometimes you may get improvement.
Right. I think the right thing to do is to go and contact an expert, which is a qualified dermatologist in
Yes.
this case. Anything related with your skin or scalp, please go and consult a qualified dermatologist. But yes, as you said, all of us, will first try some home remedies, then go for over-the-counter medication, which again is a very, important thing to address, I guess, doctor.
Yeah.
What's your stand on over-the-counter medication or creams, etc., that many normally do?
Over the counter, so many medications are available.
Right.
Uh, I won't say that they are bad, but you should be cautious that you should not using steroid containing creams.
Okay.
Okay.
Right.
If you ask them over the counter, give me acne cream, probably it may be having steroid also. So are you expert enough to identify that what cream you are buying, it does not contain steroid?
Right.
Yeah, it should be pure your anti-acne cream, like benzoyl peroxide. Yeah, I can tell you that benzoyl peroxide is commonly available. There are different percentage. Like face, you require different percentage, and for back acne, you require different percentage.
Mhm.
You are getting
Right.
my point.
Exactly.
You're using any retinoic acid cream, you should know what percentage it you have to buy and how to apply. It's a very difficult, it's not easy that you just buy a retinoic acid cream and start applying, because retinoic acid or adapalene, they are having a more irritant property also if you apply wrongly. If you apply in a large quantity, it may irritate your skin, it may cause flakiness to your skin. So
Mhm.
these are the tips you get it from a dermatologist, that how to apply.
Right.
So just buying and applying is what you think, it is not easy. You need to understand the method of application also.
Right. So it's important to understand what you're buying and how to, apply it. And again, if
Yeah,
you want the right thing, please go and consult a dermatologist, because they know your skin type, they know why the acne are, coming or popping up, and how to treat them. So many times we keep on wasting our times and trying home remedies or over-the-counter medication, or taking, advice from our friends or relatives who had acne, etc. And in this, we waste a lot of time, energy, money, etc. And by the time we reach a dermatologist, it's quite late, or the treatment may take a lot of time. I'm sure, doctor, you also get patients who had already wasted a lot of time, and if they would have come to you at the very first stage, the treatment would have been very easy. Is that right?
absolutely. See what happens if they have taken it multiple treatments which are not effective, or at home remedies they must have tried. By the time they have disfigured their face. Okay. In terms of, you will see dark patchy, blotchy patches, dark patches. So we call
Mhm.
them as a post acne pigmentation, or sometimes there could be scarring. Scarring means, khadde. Uh,
Right.
okay. So then, and they get very depressed. It is psychological impact is so profound in patients with acne. You can't
Mhm.
imagine. They don't mix up with their peers, they don't study well, they keep on seeing and mirrored, and also popping out pimples very often. So this is we called as acne excoriae. You pop out, you feel that I don't want anything on my face, why it is coming, so just you pop out. And in that term, what you do, you content of this acne, you push it down and deep into the skin, which which causes more of inflammation and consequences of or complications of acne.
Right. And many times we have seen that acne comes in our face or whichever other part of our body in a very, systematic way. Or I should say, there is like a map on our face, acne face map is there. I mean, certain areas is more prone to acne. So, doctor, would you like to shed some more light over
See,
this?
basically, if you look at the mapping of face, like it's ancient time, it was thought that forehead is, that means it is related to bladder problem, or cheeks is related to,
Mhm.
stomach problem. That is not a so. Mapping of acne skin area wise is not related to your internal problem
Okay.
at all. However, in hormonal imbalance induced acne, you get acne on jawline area.
Okay.
Okay? Mainly on a jawline area. That does not mean it has to be always there. Hormonal imbalance patient could have acne not only on this, but then overall on the forehead. So don't go by the mapping of acne practice.
Mhm. Right.
Yeah.
And doctor, this acne is just about the appearance, or it can be an underlying condition? You have already explained that, due to hormonal, changes or imbalance, acne may form. But or could be there be other underlying medical conditions?
Generally not.
Okay.
Generally not, except
Mhm.
drug-induced acne. And sometimes in a drug-induced acne, certain medications, when you take certain medication, you get acne. And it's a very classical history that you are taking drugs for long period of time, like anti-TB drugs, anti-psychiatric drugs, anti-epileptic drugs. So these drugs are, some of the drugs have potential to cause acne-like eruptions. So we need to distinguish. There are some differences between acne-like eruptions and proper acne.
Right. And doctor, does change in season triggers acne?
Yes, it's a good question, because if you look at that, some people complain of my acne improves in winter, some say that my acne improves in summer. So seasonal variation of acne is been reported and published. And this study is done by our friends from Delhi, dermatologist from Delhi. And they found that 47% of the patients reported a seasonal variation, and majority of them said that their acne worsened during summer. Now, the reason is because of, one is heat, sweating, and some of the patients said their acne worsened in winter too. Now, how do you say that? How it's possible in winter? So logical reason for worsening of acne in winter is that your skin is drying, because sebum is not produced in good quantity. So you get a dryness. And now what you do in during dryness, you apply more of moisturizers.
Mhm.
Okay. And that can cause your acne.
Okay. Right. Yeah.
Yeah.
And many a time we associate acne with our food habits, or, don't eat sugar or chocolate or oily food is what we are told. So, does oily food or any food causes or make acne worse?
Yeah. So there's a relatively relationship of your diet and acne in
Mhm.
terms of hyperglycemic diet. It is not in all patients.
Okay.
So the patient whom there is a flare or breakouts of acne because of hyperglycemic index food such as sugar, maida, wheat, bakery products, milk, potatoes. So we have seen that avoiding this stuff made their acne better. The breakouts were very less. So
Okay.
there's a role is this diet plays a role in development of acne.
And I'm sure healthy diet again will help us dealing
Yes,
well with acne.
yes, absolutely.
Okay. And what are the different types of acne? You named it. You said that some are, in form in small red, they are small red bumps. Some are in the form of cysts. So, what are the different types of
Yeah,
acne, doctor?
Sayukta, for my viewers, they should know what are the types of acne in terms that they will better understand that when to seek a dermatologist.
Right.
Like you have seen on the faces that you have blackheads. So, you know, then we have the whiteheads. Whitehead means a small white color comedons. So these are the closed comedons, and blackheads are open comedons. Now, these are non-inflammation. And so we call it as non-inflammatory lesions of acne. Now, other types are acne are your inflammatory. Now, inflammation means red bumps. Okay. Now, it has attracted bacteria. That means there is an inflammation. You require oral antibiotics for such.
Okay.
Yeah.
Right.
Patient having inflammation. Among the inflammatory lesions, we have red bumps, which do not contain pus. But sometimes you must have seen pus-filled acne. So
Yes.
we called as pustules. And sometimes we see the big bumps. So
Right.
it is a cystic,
Hmm.
soft. So it is a cystic acne. And sometimes you have multiple cystic acne connecting together. So that is a very severe form of acne. So once you understand that whatever you apply home remedies to decrease the inflammation, that means it will help for inflammatory acne. It will not help for your comedons, which is closed, that is, or it is open, that is blackheads. So whitehead and blackheads. So your home remedies will not helpful for these comedons. Remember that. The
Okay.
treatment for this comedons is your either oral systemic treatment, or sometimes we have to take it out. So expressing out this content is most crucial type. You can't just express out at parlor, any clinic.
Right.
Yeah, you have to know that how to express out.
Hmm. Right. And I was about to ask you, doctor, many a times we'll go and, go to some parlor, and the easiest way they have out is to squeeze them out with whatever tools they have. Now, how dangerous it could be, and what aftermath we can, face if we go to these
See,
parlors,
I'll
etc.
explain to you if I get page. Oh, this is your skin, correct?
Yes.
Surface, and underneath is your comedons.
Hmm.
If you are expressing on the from the top, what you are pushing only content of the acne or comedons down.
Right.
Yeah. So that is more harmful, which will cause more damage to your skin. So when we express out, we make a small nick in the skin, and then we express out the content, because then we are making the way to express out.
Right.
Okay.
Right.
So that is the difference between our procedure and at parlor procedure.
Right.
The
And
wrong,
it often leads to scarring and
yeah, because
black.
you're pushing a content down, it will cause more inflammation, and more inflammation means more scarring.
Mm,
You get pigmentation also.
okay, right.
Yeah.
Many times we have seen, especially people who are, acne prone, that treating acne is rather easy. Treating scars or,
Very
they
difficult.
are really difficult.
Yes. I
That's why, again, it's more important to go and visit a dermatologist rather than trying and, experimenting on other things, because then they'll go, through a channel. They know that, okay, treating the acne in a way that the damages minimize, etc., will take
Yeah.
place. Right, doctor?
Yes.
Okay. And is there any correlation with acne or constipation? Because many people say that, okay, you must be constipated. That's why you are having these acne. Any correlation there?
Is it not direct correlation? But however, I have seen constipation and otherwise health related issues very often is common.
Mhm.
So
Okay.
in some patients with clear skin, there are so many people are constipated, but they do not have acne. So I won't say that constipation and acne is directly correlated, but overall health-wise, it is not good.
Right. And blood impurities and acne link, as per the traditional thought, is there
Absolutely.
such a link?
No, absolutely, it is a myth.
Okay.
We do not have impure blood. By the way, if you have the
Many
impure
people
blood,
are selling so many products, many
no,
companies
no,
are
no, not
selling
at
so
all.
many products claiming that.
We do not have heart problem to have impure blood. All healthy individuals have, no, we make purification of blood ourselves.
Right.
We don't require any external thing to purify our blood.
Right. Our body is a brilliant factory in itself. Yeah, it keeps on, purifying, etc. will take place. But then, because many people, use these products, there's so much of market giving, doctor. Plus, these days, so many influencers are there. You are saying there's no connection of blood impurities and acne, but there are so many companies selling products claiming that, every month it will clean your blood and thus you'll have flawless skin. So,
What do you mean
how
by
to keep
cleaning out the blood?
ourselves out of those? Yes, doctor.
What was your question last?
Yeah,
Sorry.
that how to not fall in that trap of market gimmick or these things.
How to not to fall in the market, then you have to read about more on acne from the authentic side.
Right.
From authentic side. Second is that you think logically. What do you mean by impure? If you have the impure blood, why should you get only acne? Then you will have all health related problems.
Hmm.
That problems you are not getting, and you are just getting acne, and you are thinking your blood is impure. Nobody's blood is impure just like that.
Right. So let's not fall a prey to all these market
Yeah.
gimmicks and stay informed, stay rightly informed. And in case you have any problem, go and consult the right person, the right expert, which in the case of skin and scalp is a qualified dermatologist. And does drinking water help acne, doctor?
It's not really directly, but then less drinking can cause your drying of skin.
Hmm.
So there is one myth is that also amongst our people that only oily skin cause acne. That is not true. Even dry skin can cause acne. So acne is seen in patients with dry skin. So when you have the less water, probably you're drying out your skin. So
Right.
it's not direct relationship, but then water is important for your overall skin health.
Right. And doctor, what are the treatment options available for acne?
See, a dermatologist always see a patient according to how severe is the acne.
Right.
It's a mild form or moderate or severe. And depending upon the planning of treatment is developed. Also, we have to take the impact of patient's habits or patient's menstrual cycle relationship or relationship of breakouts of acne with the diet or sleep pattern or stress pattern also. So it's not easy to tell you that, yes, for this type of acne, you just give this treatment.
Mhm.
So basically, if the patient having very comedonal acne, so we give different treatment. The patient having inflammatory acne, that is red bumps, then we give different treatments. Apart from that, if you want a faster improvement in acne, we have to do some procedures like carbon peel, some fruit peels to fasten the treatment effect. Okay. The reason is that the most important reason is that if you keep acne on your face for a long period of time, you are bound to get scars. And for scars, once the scars develop, there is no complete cure for the scars.
Right.
Even the lasers and other laser related devices are available, but they will improve your scars to a certain extent, which means that you will not gain your skin again the way it was there before acne.
Right. Exactly. So that's why it's important to go to the right person at the right time. That's important. Don't prolong your acne, otherwise you'll get scars. And as we were talking for so long, that scars, to treat these scars, it's actually very time consuming, and other things are equally involved. The doctor, one more thing. What is a simple, skincare routine that we can go for, which can, I mean, I'm not saying that it will keep us acne free, but of course it will take care of our skin. It will be, hygienic, etc. And the basics are met.
Yeah. So I would advise that patients should wash a face with your cleansers. Now, this should not be a very harsh cleanser, a soft cleanser, and 2 or 3 times a day. Now, why some people say, no, I'm washing my face only with water. I'm plashing my water 10 times or 7 times a day. Is it good? It is not good, because you are activating your sebaceous glands by doing this. So when you activate sebaceous gland, that means the sebum is produced more. So which is not good. So I would advise only 2 to 3 times a day with a
a
good
cleanser.
cleanser. Okay. Then I will not advise for acne patients to use astringent, because it causes too much of dryness. If you're using any anti-acne cream, along with also you're using an astringent, it would cause dryness of your skin and flakiness. Now, when you're using sunscreen, it should be a gel-based sunscreen, so that your acne won't aggravate.
Okay.
And your healthy diet, that you should not use all junk food. Workout. Now you have to see that whether your acne, you are getting breakouts during your just before menstrual cycle, what we call as a pre-menstrual flare, which means you have some hormonal imbalance going on. Sometimes you will not see very obvious hormonal imbalance in your blood test also. So these are the subtle hormonal imbalance. So according to that, we decide that whether to give anti-androgens or not, oral contraceptive or not, because patients getting recurrent breakouts. Now, we have to prevent those recurrent breakouts by giving some anti-androgens or oral contraceptives in certain type of the patients. Generally, we prefer these treatment in the late onset acne after 25 years of age, because acne, which comes after 25 years of age, always has some underlying hormonal etiology.
Right. And do men also get acne, or do
Of
you get
course.
patients? Yeah.
Yeah, men
And
are not immune to acne. They
yes.
do get acne.
Yes. And what are the major causes of acne in men?
Yes, mainly they have the more of testosterone. It is a similar, more sebum secretion and clogging of your, openings, pores. The same as in females. Only in females you have the hormonal imbalance because of sometimes underlying PCOD. Now PCOD is not there in men. Okay.
Right.
But they have more of hormonal testosterone. Yeah. And the rest of the factors are similar, what I enumerated earlier.
Right. We are using a lot of masks these days, especially after COVID, and COVID is still there. The cases are increasing day by day. So masks plus the humidity plus the heat outside, we get a lot of acne under our masks. What's the reason? What's the
And plus
formulation? How
sanitizer
to
use.
prevent that?
And plus sanitizer use.
Yes, doctor. So how to prevent that?
See, basically, when you continuously wearing masks, that means it's not hygienic. Right. You don't keep on changing your mask very frequently. Right. So when you are using same mask for a long period of time, it becomes unhygienic. So anything is unhygienic is going to attract bacteria. And that's why you get mask acne. Another thing is, apart from mask acne, some people use sanitizers also on the face. Yes. I have seen all sanitizer on frequent on the hands, and then you touch your face. So that irritation can cause your acne also.
Okay. Doctor, I'll also take some of the questions from our viewers. Okay, so John Vargas is here asking, Doctor, can acne be contagious? And if yes, how can I prevent it?
Acne is not contagious.
Okay, yeah, fair enough. Maya, her question is, though we have already discussed it, but still, because it's a very common problem that people mistake that people commit. Does excessive use of cosmetic cause acne? And I would also like you to tell us that why, you were saying that removing your makeup is equally important. So use
Yes,
of excess cosmetics and removing of makeup, why it's important.
absolutely. Because when you're using excessive makeup and sometimes what a long coverage makeup, okay, so that can clog your pores and cause acne. So don't use excessive makeup whenever it is necessary, especially in those patients who has seen that when they are off makeup for and then they are getting better. So you have to realize that your makeup is the aggravating factor for your acne.
Right. Ajit Singh is asking, should I take any vitamin supplements to beat acne?
See, what we call as retinoic acid, it is a derivative of vitamin A. But just taking vitamin A may not help your inflammatory acne. So vitamin A is a water soluble. I want to make a cautious note here. Vitamin A is a water soluble. It's not water soluble. It is a fat soluble vitamin, which means that it will get deposited in your body and you may get toxicity of vitamin E. You are getting my point. So
Yes.
whenever you take any vitamins, see to that it is a water soluble or fat soluble. Don't take fat soluble vitamins in excess.
Exactly. And okay, Kirti Kapoor is here asking, Doctor, why acne mostly occurs in teenage and not in our childhood?
It's not true. Teenage, it occurs because of there is a sudden surge in testosterone level, which is required for growth. And that's why there is an overproduction of sebum and so on. But however, teenage also we see acne, and this is because of passage of hormones from mother to a newborn. So we call it as a neonatal acne. It's not common, but it has been seen, neonatal acne.
Okay, it's there, right. Adi Jain is here asking, what diet should I follow for resolving acne problems?
As I told you, that don't take, in fact, even wheat also, you can cut down on a wheat. You can go on to jowar, bajra, so which has a low
Millets.
glycemic, yeah, millets,
Yes.
and bakery products, ice creams, biscuits, any bakery products, milk related products. You try and cut down this, then you realize that if you're getting acne better, that means you have that link.
Right. And many a times people, deny taking acne treatments. They'll have acne pop-ups, but they won't go to a doctor. And even if they go to them, they'll say that, I'm not up for any acne treatment. What you normally advise them?
Very difficult question. And very difficult to treat such patients also.
I can understand, yes.
What advice we have to tell them? We tell them that what would be the consequences of acne if it is not been timely treated.
Right.
Okay. And if they understand, they take medication. If they don't understand, they will be loser at from their point of view. Okay.
Exactly.
Yeah.
Right. Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
I would say that in acne, it looks very simple. It's very common. And then we discuss amongst our friends, and then somebody tells you, or you use this cream, use that cream. I got benefited. I will tell that refrain from this advisor. Okay. Also, Don't try to use any creams frequently, every week. Today you applied one cream, next week you will start using another cream, seeing that, oh, there is no effect in 1 week. Let me use. So in that approach, you are irritating your skin, and which can cause more breakouts. Also, don't share makeups, any makeup brushes or any applications. Don't use old cosmetics.
Right.
And some of the patients, I will tell you, some of the patients, despite on proper acne treatment by a dermatologist, do not get improvement. Such patients I have seen, they should follow that stress level. They should observe their stress level.
Mm-hmm. Right.
Because when the treatment is proper, why should they should not get improvement? So sleeping well, eating well, okay, and no stress. And if you know that nowadays, if your work stress is so much amongst youngsters.
True.
Yeah.
So leading a healthy lifestyle, staying healthy, your overall health is important. And for, of course, sleeping well, eating well, stress-free life is important. So we can definitely donate some, or invest some of our time in something which we really enjoy. That
Yes.
will keep us
Absolutely.
stress-free. Right. Thank you so very much, Dr. Rachita Dhurat. It was wonderful talking to you. And thank you so very much for your valuable time. And we are really looking forward for many more such sessions in coming times, Doctor.
Thank you, Sanyukta, and thank you, my lovely audience.
Viewers, thank you for an excellent participation. For more information and updates on skin health and care, stay connected on our YouTube channel, Hair All Issues Resolved. Thank you. Have a good day ahead. Good night.